So question 3, what is question 3 saying? Question 3 says Miss Salome is a 56-year-old mother with 3 children. The husband died last year, and because of that, she has been under a lot of stress. She was brought to the hospital where you work, and at the OPD, outpatient department. The following were recorded: temperature 38 degrees Celsius, blood pressure 150 degree, 150 on 100 millimeters of mercury, pulse rate 92 beats per minute, respiratory rate 22 cycles per minute, and weight 80, 89, 85 kilograms. She complained of headache, back pain, muscle weakness, fatigue, polydipsia, polyuria. Polydipsia is excess taste for water, right? Polyuria, excess urine, that's voiding out so much amount of urine. Upon physical examination, the physician noted a moon-shaped face and a buffalo horn and a purple-red band on the thigh and the breast. A. State the medical diagnosis of this patient. B. Outline 4 other causes or risk factors associated with this condition. C. State a definite diagnostic test for this condition. Outline 4 specific patients teaching you will render to Ms. Salome upon her discharge. That's 5 marks. State any 4 complications that can result if her case is not well managed. Something very, very, very striking. I love that. I love that. Take note of that. We said the temperature is 38, the temperature is high, right? Blood pressure is also high. Pulse rate for mama of 56 years old is also high. Respiratory rate is within normal limits. The weight, they are not giving us a height, so we don't have anything to do with body mass index. Are you guys getting? So each time when you see the question, they give you question and then they give you height, know that they will demand that you do a body mass index. And at this point in time, she is having high blood pressure, as we can say. And then upon physical examination, we look at the signs and symptoms. We said she has headache, she has backache, she has muscle weakness, and she has fatigue. She has polydipsia. Take note of that. She has polydipsia. And then she also has polyuria. Polydipsia and we have polydipsia, excess taste for water. Then we have polyphagia, excess taste for food. There are 4 cardinal signs for diabetes: polyphagia, excess taste for food; polydipsia, excess taste for water; polyuria, excess urination, frequent urination, even at night; and nocturia also, right? And these are the cardinal symptoms for diabetes mellitus. Take note of that. And then we are saying upon physical examination, the physician noticed moon-shaped face and a buffalo horn and a purple band on the thigh and the breast. When you see buffalo horn is always found behind, just at the cervical bone, right? These cervical bones at the neck, these bones of the neck, just going down to the thoracic bones, right? At that level, like that, the first or second thoracic bone, and then with that, you will notice that she had a buffalo horn. That's where that buffalo horn is always found. And then when you start seeing moon-shaped structure, there's something is already driving us to. There is a disease we call Cushing's syndrome. We call it Cushing's syndrome. Take note of that disease. Cushing's syndrome. Please, when you listen to the audio, react. Don't just sit like that. Well, the reason why we are doing all of this is so that we can get acquainted with the question. We should not be afraid of answering questions. We should become, how do I put it? We should have doubt. We should not have doubt for ourselves. We should have mastered questions and master the setting, how questions are coming. Because you see a question like this, just like this example that I'm already saying here. This is a case already. This is a case study already. It's already bringing us to Cushing's syndrome. Imagine that if you do not do it in school or in class, it means that you will fail the marks. And how many marks are even there? They say that particular section C is 50 marks, therefore 3. So you see that you fail so much. So what are we therefore saying? We are doing all this so that you may gain confidence for yourself. You may understand how DC setting, how HND setting comes, and you may also master the ability. You may master how questions come every year. You may have confidence in yourself. At least if you can answer more than 100 questions in case study and you dwell there, like I said, those of you who don't even listen to the audios, you go and react. You go faster to go and react. You are starving yourself of knowledge. You are preventing yourself of knowledge. It's a foolish way of behaving. I demand that when you listen, you should react. But I'm not saying that you should react when you have not listened. And don't listen one time. Listen over and over and over again. It will boost your morale. It will boost your confidence. It will expose your weaknesses as far as the HND is concerned. You don't prepare for the HND when it's already at the, let's say, April or start May. You start running after lecturers and paying 5,000, 10,000 pounds for classes. It's good. Now is the time for you to start grinding things gradually. So before that time is arriving, even if you're paying, you will not get much. Like I told you guys before, during that period, I'll also be involved inside, but I cannot say everything in a single class of 2 hours. I can't. That one is no lecturer can do that. So it's now gradually as we are going, I'm saying things, see your faults, cover them, see your faults, cover them, see your faults, cover them. You can hear like that and throw. I'm seeing somebody asking, is meningitis hereditary? Meningitis, it can be hereditary, but it's not hereditary. It's not. You don't inherit it from your parents. You don't, or from. It's not. It doesn't have genes. It doesn't have genes. It comes along life. Yes, that's good. Is it Myram or something? He's a Muslim person, but I don't even know the person's name. So it's not heredity. You don't inherit it. So we are saying we are looking at the buffalo home. That's what is pushing us to say it is. Or it is Cushing syndrome because of buffalo horn. Because there's no disease that has buffalo horn or moon shaped structure. Take note of that. Uh, they say outline 4 other causes or risk factors associated with this condition. The first risk factor, diabetes mellitus, just as we have seen those symptoms that the mother brought. Those symptoms are cardinal with diabetes mellitus. And so when we see those symptoms, it pushes us to say diabetes mellitus is one of the risk factor to that condition. And also hypertension, high blood pressure is a risk factor to Cushing's syndrome and other infections. Kidney diseases, and the most common kidney disease is mostly at time kidney stone. Right. Various forms of cancer is a pre-exposing factor, right, to that condition. And also hormonal malformation, malnutrition, and all of that. Even alcoholism can result to that. So those who are diabetic and then they drink alcohol like them, like they have vowed that they must end with alcohol. So we have seen those risk factors: diabetes mellitus, high blood pressure, malnutrition, alcoholism, and so many others. Kidney diseases, kidney stone. You can get enlargement of organs. You can get even the pituitary and all of that. Hormonal imbalance. Hormonal imbalance can result to Cushing's syndrome. Right? Hormonal imbalance can result to Cushing's syndrome. Various forms of cancer can result to Cushing's syndrome, and all of that. And get 5 marks. State a definite diagnostic test for this condition. What is the best test that we can do for a patient of this kind? As we have said, the risk factors also can guide us on the various laboratory investigations that we can give for this patient. Now, we are seeing a buffalo horn, the growth that is found at the back there, right? And also excessive fats at the level of the stomach for a woman. We start, what are we doing? We do CT scan, right? We do CT scan. Take note, we do CT scan, we do urine analysis. We also do some blood tests to check for diabetes mellitus and the level at which the person's blood sugar is. and other diseases. We said some of the risk factors is chronic infection, right? We check for other infections, kidney diseases, GIT infections, hormonal imbalance, and all of that. When we do that, we can also do an ultrasound, right? We can do an ultrasound, and then we also measure the body mass index to check. So those are the various ways we diagnose this patient, the definite diagnostic test. Outline for specific patients teaching you will render to Madam Salome. Just as we have said, the risk factors, what are you going to tell this patient? Are we there? Outline for specific patients teaching you will advise to, you will give, right? Just as we said about the risk factors, malnutrition and all the like, we advise the patient to eat a balanced diet. We advise the sugar level to be dropped down, to be dropped down. We also advise that the weight of the patient should be dropped down. Also, the patient should work on his weight, reduce, manage his stress, and all that stuff. Both stress is always going to be there, but now we manage it because of hypertension. And now, if this condition is not managed, what can it result to? Stroke. Right. This is the for any. Yeah. So, what are the four? Diet, right? To try as much as possible to work on the diet. Try as much as possible to employ good hygienic condition. The mother should try to work on prevention than treatment. Man, prevention is better than cure. So the mother should watch what she eats and everything, and increase water intake because it will help to release, prevent from kidney diseases, and then balance diet, manage sugar level, and all of that. And then, so that's it. So when we look at four complications that can result if her case is not well managed, the first thing is stroke, right? The first thing is stroke. If it's not well managed, it can aggravate to many other conditions. It can result to severe kidney stone, that can result to kidney transplant, right? And in her age, you will start seeing a bone infection. Then the risk of stroke is also very common to such patients, right? Because of the blood pressure that is increased, stroke can set in. Diabetes mellitus can be permanent, and all of that. Ions imbalance, hormonal, when the fact that there is hormonal imbalance that is a risk factor to this condition, it can also cause severe hormonal imbalance in the body. Okay, let me just answer the question of Madam. Meningitis is contagious. If you have a close relative, have a close person that you are handling or treating that has meningitis, especially when it's bacterial or viral meningitis. How will you know that it's bacterial or viral meningitis unless the test is done? So when it's done, you will then know whether it's bacteria. When it's bacterial meningitis, you can even get it even from the breath of the person because bacteria spread, they multiply rapidly, and you and I know that meningitis affect the meninges of the brain. It affects the meninges of the brain, right? Whereby the arachnoid, the PM matter, the arachnoid, and the dura matter is affected, right? Because the bacteria goes and feed on that, and along that way can have access to the lungs. Most people who have meningitis may have cough also, and when you're close to them, you can get it even from their breath. So it's contagious. A close contact with a person, if you don't manage yourself properly, you can also carry the meningitis. You can also carry the bacteria. So most often at time, when working with such patients, you need to also handle yourself with care, put on masks and all of that. So that's it.